So, Autumn Bardisa treated 4,486 patients as a nurse in Florida, and she wasn't a nurse. She stole the license number of another woman also, named Autumn, who went to her same school, used it for over a year, and she probably would have kept going too. But then her hospital offered her a promotion, and that's when someone finally decided to check if she was licensed. She wasn't. Now, Autumn was 29 years old, living in Palm Coast, Florida. Palm Coast is one of those mid-sized Florida cities on the northeast coast. About 100,000 people. Not exactly a small town, but not a major metro either. The kind of place where a hospital like AdventHealth Palm Coast Parkway is one of the bigger employers in the area. And that's where Autumn applied for a job in 2023. On paper, she looked fine. She told them she was an Education First registered nurse. And if you don't know what that means, it's basically a designation for someone who finished nursing school but hasn't taken the national licensing exam yet, the NCLEX. That's the big test every nurse has to pass before they can legally practice. Some hospitals will hire Education First nurses and let them work in a limited capacity while they study for the exam. It's not unusual. So AdventHealth brought Autumn on as an advanced nurse technician in July 2023, and at that point the arrangement made sense. She'd work in a support role. She'd study. She'd take the exam. Everybody's happy, except Autumn never took the exam, and she had no intention of taking it, at least not then. For a while, nothing seemed off. Autumn showed up to work, did the job, nobody raised a red flag. But the thing about pretending to be a nurse is you eventually need an actual license number to move up, and Autumn didn't have one, so she found someone who did. There was another woman who went to the same nursing college as Autumn. Her name was Autumn Hood. Same first name, different last name. And Autumn Bardisa took Autumn Hood's nursing license number and submitted it on her own paperwork at AdventHealth. Just put someone else's credentials down as if they were hers. Now you'd think this would fall apart immediately. The names don't match. Autumn Bardisa is not Autumn Hood. The license says one name, her employee file says another. But when the hospital flagged the discrepancy, Autumn had an answer ready. She told them she'd recently gotten married and changed her last name. That's why the license said Hood instead of Bardisa. Simple explanation. Totally plausible. And they bought it. I guess you'd think the next step would be asking for a marriage certificate. And they did ask, but Autumn just never provided one. She kept telling them she'd bring it in. Next week. Soon. And somehow, weeks turned into months and that was enough. Nobody put up hard up enough to enforce it. Nobody put a hold on her access or escalated the issue. She just kept working. Because at some point, the hospital's own credentialing process failed. They had a nurse working under someone else's license with a name that didn't match and no supporting documentation. And they let it continue. For months. By June 2024, Autumn had moved from her technician role into full-scope patient care. She was functioning as a registered nurse, assessments, medications, treatment decisions, the whole deal. And she did this for 7 straight months. Between June 2024 and January 2025, 4,486 patients came through her care. Almost 4,500 people went to a hospital, trusted the person treating them, and had no idea that person was not legally qualified to do any of it. No license, no exam, no legal authority. Just a stolen credential and a fake marriage story. And Autumn wasn't doing paperwork in the back. She was making medical decisions. If you've ever been in a hospital, you know nurses are the ones doing most of the hands-on work. They're the ones checking vitals, administering meds, responding to changes in your condition. Autumn was doing all of that. For 7 months, without a license. She didn't get caught by some whistleblower or a patient complaint. It was way more mundane than that. In January 2025, AdventHealth offered Autumn a promotion. A better position within the hospital. And as part of the promotion process, someone on the hiring team ran a routine credential verification. Standard background check stuff. They pulled up her license status, and what they found was that Autumn's CNA license, the basic certified site-distant credential sheet had at point, was expired. Not suspended. Not under investigation. Just expired. She hadn't renewed it, and the registered nurse license she'd been using, that belonged to Autumn Hood. A completely different person. That was January 22nd, 2025. AdventHealth terminated her that same day, and then they picked up the phone and called the Flagler County Sheriff's Office. Because this wasn't just a credentialing mistake. This was fraud, identity theft, and potentially a public safety issue involving thousands of patients. Now what followed was a 7-month criminal investigation. And it was not a small one. The Flagler County Sheriff's Office brought in the Florida Department of Health. They brought in the U.S. Department of Health and Human Services. 2 federal and state agencies, working alongside local law enforcement. They went through every patient record, every shift log, every piece of documentation Autumn had ever touched at that hospital. And on August 5, 2025, investigators showed up at Autumn's house to assist her. She was wearing scrubs. You cannot make this up. 7 months after getting fired for pretending to be a nurse, Autumn Bardisa answered the door dressed for a shift. Whether she was working somewhere else or just liked the outfit, I have no idea. But the optics are incredible. Autumn was charged with 7 counts of practicing healthcare without a license and 7 counts of fraudulent use of personal identification. That second set of charges is for stealing Autumn Hood's license number and using it as her own. They set her bond at $70,000. The Flagler County Sheriff Rick Staley went on record calling it one of the most disturbing cases of medical fraud his office had ever investigated. And if you ask me, the disturbing part isn't just that Autumn did it. It's how long it took anyone to notice. 1.5 years. 18 months. She walked into a hospital, handed them someone else's credentials, gave a flimsy explanation for the name mismatch, and nobody followed through. And then there's Autumn Hood, the real nurse, the woman whose license got stolen. She had no idea any of this was happening. She and Autumn Bardisa went to the same nursing college but didn't know each other personally. They weren't friends. They weren't in the same class. Autumn Hood just woke up one day and found out someone had been using her credentials to treat thousands of patients at a hospital she'd never worked at. Her name was attached to every one of those patient encounters. Her professional reputation was on the line for care she never provided. If you're finding this one interesting, hit subscribe. More stories like this every week. So the case moved through the court system, and in April 2020, Autumn Bardisa took a plea deal, 5 years of probation, 50 hours of community service, and she was required to write an apology letter to Autumn Hood. That was part of the plea agreement. Write a letter saying sorry for stealing her identity and using it to practice medicine illegally for over a year. 5 years probation and a sorry letter for treating almost 4,500 patients without a license. Between August 2025 and April 2026, while Autumn was out on bond waiting for her case to go through the courts, she went and took the NCLEX, the National Licensing Exam. The test she'd been avoiding this entire time, and she passed. She got a real legitimate nursing license, on her own, under her own name. And then she had to give it up. The plea deal required her to forfeit the license to the Florida Department of Health. She's prohibited from practicing any form of medicine for the entire 5 years of her probation. So she spent over a year faking it, got caught, got arrested, then proved she could have done it legitimately the whole time, and now she can't use it anyway. If you ask me, that might be the most frustrating detail in the whole case. She had the ability to pass. She could have just taken the exam in 2023 and none of this would have happened. No stolen identity, no criminal charges, no investigation. She just didn't. Now, as for the patients, the sheriff's office said that, to their knowledge, nobody was physically injured or died as a direct result of Autumn's care, which is fortunate. But that doesn't mean there was no harm. 4,486 people received medical treatment from someone who had no legal right to provide it. AdventHealth had to go back and review every single one of those patient records. Every assessment Autumn made, every medication she administered, every clinical decision. And for the patients themselves, there's no easy way to process finding out your nurse wasn't actually a nurse. Especially if you were there for something serious. You trusted the hospital. You trusted the person taking your blood pressure, reading your charts, giving you medication. And that trust was based on a lie. AdventHealth hasn't said much publicly beyond confirming they terminated Autumn and reported her to law enforcement. They haven't commented on what changes, if any, they've made to their credentialing process. Which, if you ask me, might be the bigger conversation here. Because Autumn didn't hack into a system. She didn't forge a license. She took someone else's number, wrote it on a form, and nobody verified it for 1.5 years. No prison time, 5 years of probation, 50 hours of community service, and an apology letter, and a nursing license she earned for real but will never get to use. For impersonating a medical professional and treating almost 4,500 patients at a Florida hospital. You get the point. If you like this one, there's more stories like this on the channel.